High blood pressure, or hypertension, is one of the most common and serious health issues in older adults. Yet many seniors unknowingly make everyday mistakes that can worsen their condition or interfere with treatment. These errors are often overlooked but can increase the risk of heart disease, stroke, kidney damage, and other complications. In this video, we'll identify 7 specific habits that older adults should stop immediately to protect their blood pressure and improve long-term cardiovascular health. Each point is based on clinical research and common recommendations from medical professionals. Skipping or inconsistently taking blood pressure medication. One of the most common and potentially dangerous mistakes seniors make is skipping their prescribed blood pressure medication or taking it inconsistently. This behavior is often based on a misunderstanding that medication is only necessary when symptoms are present or when readings seem high. In reality, hypertension is frequently asymptomatic, and its damage can accumulate silently over time. Blood pressure medication works by maintaining a consistent level of therapeutic effect in the body. When doses are missed or taken irregularly, blood pressure can fluctuate unpredictably, increasing strain on the heart and blood vessels. These fluctuations may lead to serious complications such as stroke, heart attack, or kidney failure. A 2020 study published in The Lancet followed over 18,000 individuals aged 65 and older and found that poor adherence to antihypertensive medication doubled the risk of cardiovascular events compared to consistent adherence. The study emphasized that even missing medication once or twice a week was associated with a measurable increase in risk. This pattern is particularly concerning in older adults, who may be managing multiple health conditions and medications. Cognitive changes, visual impairment, or simple forgetfulness can all contribute to irregular use. For example, Linda, 72, had been prescribed medication for high blood pressure but admitted she only took it when her head felt heavy. After experiencing a transient ischemic attack (TIA), her physician clarified that consistent dosing, not symptom-based use, is essential, even when she feels fine. To improve medication adherence, seniors are encouraged to use tools such as daily pill organizers, alarms, or medication reminder apps. Some pharmacies also offer blister packs or synchronized refill schedules to reduce confusion. Importantly, healthcare providers should routinely review all medications with older patients, ensuring they understand the purpose and schedule of each one. Finally, it's essential to avoid making changes to blood pressure medication without medical consultation. Some patients stop taking their pills due to side effects, unaware that alternative formulations or adjusted dosages may resolve the issue. A 2019 guideline from the American Heart Association recommends regular follow-ups to assess both blood pressure control and patient tolerance to medication regimens. In summary, skipping or altering blood pressure medication without guidance can lead to significant health risks. Consistency, communication with healthcare providers, and practical adherence strategies are critical to maintaining safe and effective blood pressure control. Using the wrong blood pressure cuff size at home. Accurate blood pressure monitoring at home is a key component of hypertension management, particularly in older adults. However, one commonly overlooked issue is the use of an incorrectly sized blood pressure cuff. This simple mistake can lead to inaccurate readings, which in turn may cause inappropriate medication adjustments or delayed diagnosis. The size of the cuff directly affects the accuracy of the measurement. A cuff that is too small for the upper arm can artificially elevate readings, while a cuff that is too large may underestimate true blood pressure levels. According to a 2017 study published in the Journal of Clinical Hypertension, using a cuff that does not match the patient's arm circumference can result in deviations of up to 10–15 millimeters in either direction. This level of inaccuracy is clinically significant and can affect treatment outcomes. Older adults often experience changes in body composition, including muscle loss and changes in fat distribution, which may affect upper arm size. Despite this, many patients continue to use the same cuff size for years without reassessment. Additionally, some home blood pressure monitors come with only one standard-sized cuff, which may not be appropriate for all users. A 2022 clinical review in hypertension research emphasized the importance of individualized cuff selection, especially in seniors with obesity or frailty. The authors recommend that patients measure the circumference of their upper arm and compare it with the manufacturer's cuff sizing chart. If unsure, patients should bring their monitor to a healthcare provider or pharmacist for assistance in verifying proper fit. In one observational audit, nearly 35% of home users aged 65 and above were found to be using a cuff that did not match their arm size. According to guidelines published by the American Heart Association (AHA) in 2019. This discrepancy can lead to long-term errors in blood pressure tracking and misinterpretation of treatment effectiveness. Moreover, cuff positioning and posture during measurement are equally important. The cuff should be placed on a bare upper arm, aligned with the heart level, and the individual should remain seated, relaxed, and silent for at least 5 minutes before taking the reading. These procedural steps are outlined in the AHA's Standardized Blood Pressure Measurement Protocol to reduce variability. For older adults, managing hypertension at home, routine evaluation of equipment is advisable. Blood pressure monitors should be validated for accuracy every 1-2 years, and cuff size should be checked during annual medical visits, especially if there has been significant weight change. In conclusion, using the wrong cuff size is a subtle but serious error that can compromise blood pressure management. Accurate readings require the right equipment, proper technique, and periodic reassessment. Addressing this simple issue can lead to more effective monitoring and safer blood pressure control in older adults. Consuming excess sodium without realizing it. Excessive sodium intake remains one of the most significant contributors to elevated blood pressure, especially in older adults. While many seniors are aware of the need to reduce salt, they often underestimate how much sodium they are actually consuming. This is largely due to the hidden sodium content in everyday processed and packaged foods. According to the Centers for Disease Control and Prevention (CDC), more than 70% of the sodium in a typical diet comes not from the salt shaker, but from processed foods such as canned soups, deli meats, bread, cheese, sauces, and frozen meals. Even items that don't taste particularly salty can contribute significantly to daily sodium intake. For instance, one slice of commercially baked bread can contain up to 230 milligrams of sodium, and a single cup of canned soup may provide over 900 milligrams. The American Heart Association recommends that adults, particularly those over age 60, consume no more than 500 milligrams of sodium per day. However, national surveys consistently show that the average sodium intake among seniors in the U.S. exceeds 3,000 milligrams daily, more than double the ideal amount. This chronic excess can lead to fluid retention, increased vascular resistance, and long-term elevation of systolic blood pressure. A 2019 meta-analysis published in the BMJ reviewed 185 studies involving over 170,000 participants and found a strong correlation between high sodium intake and increased cardiovascular risk, particularly among those with pre-existing hypertension. The study concluded that even modest reductions in sodium, around 1,000 milligrams per day, could significantly lower blood pressure and reduce the risk of stroke and heart attack. Older adults are particularly vulnerable to the effects of high sodium due to age-related changes in kidney function, which impair the body's ability to excrete excess salt. This can lead to more pronounced increases in blood pressure and a higher risk of congestive heart failure. For example, John, 74, was managing his blood pressure with medication, but continued to consume high-sodium frozen dinners for convenience. After experiencing elevated readings despite treatment, a dietary review revealed his sodium intake exceeded 4,000 mg daily. With dietary adjustments, including more fresh foods and low-sodium alternatives, his blood pressure stabilized without the need for increased medication. To reduce sodium intake, older adults are encouraged to read nutrition labels carefully, paying attention to sodium per serving. Choose products labeled low sodium or no salt added. Limit consumption of processed meats, instant noodles, pickled foods, and commercial sauces. Cook more meals at home using herbs and spices instead of salt for flavor. The World Health Organization has emphasized population-wide sodium reduction as one of the most cost-effective strategies to prevent cardiovascular disease. For seniors, even small, consistent changes in dietary sodium can lead to meaningful improvements in blood pressure control. In summary, hidden sodium is a common and preventable factor in poor blood pressure management among older adults. Awareness, label literacy, and simple dietary swaps can help reduce intake and support healthier cardiovascular outcomes over time. Not drinking enough water. Hydration is often overlooked in discussions about blood pressure, yet it plays a critical role in cardiovascular stability, especially in older adults. Inadequate fluid intake can lead to a reduction in blood volume, increased blood viscosity, and a compensatory rise in blood pressure. Over time, chronic low-level dehydration can place strain on both the heart and kidneys, contributing to long-term hypertension and associated risks. As people age, the body's natural thirst response diminishes, making older adults less likely to feel thirsty, even when their fluid levels are low. Additionally, concerns about urinary frequency or incontinence may lead some seniors to intentionally limit fluid intake. These factors, combined with common medications such as diuretics or laxatives, increase the risk of dehydration. A 2022 study published in the journal Hypertension examined hydration markers in adults over age 60 and found that those with consistently low serum water balance had significantly higher systolic blood pressure readings compared to well-hydrated individuals. The study also noted an increased prevalence of left ventricular hypertrophy, a sign of chronic heart strain in the dehydrated group. Even mild dehydration has been shown to elevate blood pressure by triggering the release of vasopressin, a hormone that causes blood vessels to constrict and the kidneys to retain sodium. While this response is intended to preserve fluid levels during acute dehydration, its chronic activation can contribute to sustained hypertension. In addition, thicker blood increases vascular resistance, which further elevates blood pressure and may impair circulation to critical organs. One practical case involves James, 75, who experienced frequent headaches and unexpected blood pressure spikes despite following his medication plan. Upon clinical review, it was revealed that his daily fluid intake was limited to less than 1 liter, mainly through caffeinated beverages such as coffee and tea. After incorporating more water into his routine, about 1.5 to 2 liters per day, his symptoms lessened, and his blood pressure readings improved noticeably during follow-up visits. To maintain adequate hydration, older adults are generally advised to consume 6 to 8 cups of fluid per day, primarily from water. This amount may vary based on individual medical conditions, such as heart or kidney disease, and should always be guided by a healthcare provider. Distributing fluid intake evenly throughout the day is preferable to consuming large amounts at once. A simple and practical method to assess hydration status is by observing urine color. Light yellow urine usually indicates adequate hydration, whereas darker shades may suggest a need to increase fluid intake. This visual cue is especially useful for seniors whose thirst response is diminished. It is also important to account for medications that promote fluid loss. Diuretics, for example, are commonly prescribed to manage hypertension, but can increase the risk of dehydration if fluid intake is not adjusted accordingly. In such cases, additional fluids may be necessary to maintain balance and prevent blood pressure instability. Incorporating hydrating foods into the daily diet can further support overall fluid intake. Foods such as cucumbers, melons, oranges, and clear soups provide water along with essential nutrients, making them particularly helpful for individuals who find it challenging to drink large amounts of liquid. These dietary strategies can enhance hydration and support cardiovascular health without significantly altering meal routines. In summary, chronic dehydration is a subtle but important factor that can exacerbate high blood pressure in seniors. Proactive hydration strategies including regular fluid intake, monitoring of urine color, awareness of medication effects, and consumption of water-rich foods can support more stable blood pressure control and reduce the long-term burden on the cardiovascular system. Addressing hydration is a simple yet effective way to support overall vascular health in older adults. Sitting too long without movement. Prolonged sitting is a common and often underestimated risk factor for elevated blood pressure in older adults. As mobility naturally decreases with age, many seniors spend large portions of their day seated watching television, reading, or resting. While these activities may appear harmless, extended periods of physical inactivity can negatively impact vascular health and contribute to blood pressure instability. When the body remains still for extended durations, particularly in a seated position, circulation slows. Blood tends to pool in the lower extremities, leading to reduced venous return to the heart. To compensate, the heart may increase its workload, and the blood vessels constrict, raising overall vascular resistance. These physiological responses can result in elevated systolic pressure, especially in the afternoon or evening hours. A 2018 study published in Hypertension tracked over 7,000 adults aged 60 and older and found that those who sat for more than 8 hours per day had significantly higher systolic blood pressure compared to those who broke up their sitting time with short bouts of activity. Even brief periods of light movement such as standing or slow walking for 3 to 5 minutes every hour were associated with measurable improvements in vascular function and blood pressure control. In older adults, prolonged sedentary behavior is also linked to reduced baroreceptor sensitivity, the body's natural mechanism for maintaining stable blood pressure during position changes. As a result, seniors who sit for too long may experience orthostatic hypotension, a sudden drop in pressure when standing followed by a reactive increase in pressure, creating greater variability throughout the day. A practical example involves Maria, 76, who reported late-day headaches and blood pressure fluctuations despite stable medication use. Upon further evaluation, her physician learned she spent long hours in a recliner with little movement throughout the day. After incorporating 5-minute walking breaks every hour and standing after meals, her symptoms improved, and her home blood pressure readings showed better consistency over time. To address this issue, healthcare professionals recommend that older adults incorporate regular movement throughout the day, even if intense physical exercise is not possible. Standing up and stretching for a few minutes every 30 to 60 minutes can promote better blood flow and reduce vascular stiffness. Light activities such as walking indoors, doing gentle leg lifts, or using resistance bands while seated are practical and low-impact options. According to the American College of Cardiology 2021, encouraging non-exercise physical activity, such as household tasks, gardening, or walking around the home, can contribute meaningfully to blood pressure regulation in seniors. These forms of movement stimulate the endothelium, the inner lining of blood vessels, improve arterial flexibility, and reduce resting blood pressure over time. It is also important to evaluate the physical environment. Seniors should arrange seating areas to make standing and moving easier. Use supportive footwear indoors, and place commonly used items in positions that encourage gentle movement. Timers or reminder devices can help establish regular intervals for getting up, especially in those with limited mobility or memory challenges. In summary, extended periods of sitting may silently worsen blood pressure control in older adults by reducing circulation, increasing vascular stiffness, and disrupting autonomic balance. Integrating simple movement routines throughout the day is a practical, evidence-based strategy that supports healthier blood pressure patterns and reduces cardiovascular strain. Even modest physical activity, when performed consistently, can yield meaningful health benefits over time. Taking over-the-counter pain relievers without medical guidance, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, naproxen, and certain combination cold medications, are commonly used by older adults to manage joint pain, headaches, and minor injuries. While these drugs are widely available and often perceived as safe, frequent or prolonged use, especially without medical supervision, can interfere with blood pressure control and pose cardiovascular risks. NSAIDs work by inhibiting cyclooxygenase enzymes COX-1 and COX-2, which reduces inflammation and pain. However, this mechanism also affects kidney function and sodium retention. When sodium and fluid are retained in the body, blood volume increases, leading to higher blood pressure. This effect is more pronounced in older adults, particularly those with pre-existing hypertension or kidney impairment. A 2017 systematic review published in European Heart Journal analyzed multiple studies involving older populations and concluded that regular NSAID use was associated with an average increase of 3 to 6 mmHg in systolic blood pressure. In patients with uncontrolled hypertension, the increase was even higher, potentially necessitating additional antihypertensive medication or dosage adjustments. In 2019, the American College of Cardiology and American Heart Association issued a joint clinical update warning about the cardiovascular risks of NSAIDs in patients with or at risk for hypertension, heart failure, or chronic kidney disease. The recommendation emphasized that older adults using NSAIDs should be closely monitored and that alternative pain management strategies should be considered where possible. An illustrative case involves Harold, 73, who began using over-the-counter ibuprofen daily to manage chronic knee pain. Despite adherence to his prescribed blood pressure medication, his readings began to rise over a 2-month period. Upon reviewing his medication use with his physician, the NSAID was identified as a likely contributor. After transitioning to physical therapy and acetaminophen under supervision, his blood pressure stabilized and his joint symptoms remained manageable. NSAIDs can also interact with common blood pressure medications, including ACE inhibitors, diuretics, and beta blockers. These interactions may blunt the effect of antihypertensive drugs or further strain renal function, especially in patients with reduced glomerular filtration rates. For this reason, physicians often advise limiting NSAID use in seniors and instead recommend other modalities such as topical analgesics, stretching, low-impact exercise, and heat or cold therapy. In addition, some combination cold and flu medications contain hidden NSAIDs or decongestants like pseudoephedrine, which can significantly elevate blood pressure. Older adults should read labels carefully and consult healthcare providers before using any new over-the-counter products, even those marketed as mild or natural. For those who require occasional NSAID use, it is advisable to use the lowest effective dose for the shortest possible duration. Avoid combining multiple NSAIDs or using them with alcohol or other nephrotoxic substances. Schedule regular checkups to monitor kidney function and blood pressure if NSAID use is ongoing. In summary, while NSAIDs are effective for short-term pain relief, their impact on blood pressure regulation should not be underestimated in older adults. Long-term or unsupervised use may compromise cardiovascular and kidney health. Discussing pain management options with a healthcare provider can help reduce unnecessary risks and support safer, more effective blood pressure control. Ignoring morning blood pressure spikes. Blood pressure is not static throughout the day. It follows a natural circadian rhythm. In most individuals, blood pressure dips during sleep and begins to rise in the early morning hours, typically between 6:00 a.m. and 10:00 a.m. This phenomenon, known as the morning surge, is a normal physiological process. However, in older adults or those with hypertension, this surge can become exaggerated, leading to elevated cardiovascular risk. Research has shown that abnormally high morning spikes in blood pressure are associated with an increased incidence of heart attacks, strokes, and sudden cardiac events. A landmark 2010 study published in Hypertension followed over 5,000 patients with treated hypertension and found that individuals with pronounced morning blood pressure surges had a significantly higher risk of stroke, particularly ischemic stroke, than those with more stable patterns. In aging adults, the morning surge can be influenced by several factors, including poor blood pressure control during the night, inadequate medication timing, sleep apnea, or increased arterial stiffness. Because many of these factors progress silently, seniors may not realize their blood pressure readings are spiking during the early hours unless they are regularly measuring at that time. For instance, Thomas, 78, consistently measured his blood pressure mid-morning and found it within normal range. However, after experiencing symptoms of lightheadedness and chest discomfort upon waking, his physician recommended early morning monitoring. Subsequent readings revealed a consistent spike of over 160/95 mmHg between 6:30 and 7:00 a.m., prompting a change in medication timing. Following adjustment, his blood pressure profile improved and his morning symptoms resolved. The clinical importance of morning blood pressure monitoring is emphasized in the 2021 European Society of Hypertension guidelines, which recommend that patients, especially older adults and those at high cardiovascular risk, include early morning readings in their home monitoring routine. This data provides more accurate insight into overall blood pressure control and may reveal hidden risk that would otherwise go undetected during routine office visits. To identify and manage morning surges effectively, seniors are encouraged to measure blood pressure within 1 hour of waking, before eating or taking medications. Keep a consistent schedule of home monitoring, including at least 2 readings per day, morning and evening. Share home measurement logs with their healthcare provider for pattern evaluation. Discuss medication timing with a physician, as certain antihypertensive drugs may be more effective when taken in the evening to blunt morning surges. Pharmacological strategies to address the morning surge may include long-acting medications or evening dosing schedules to provide better 24-hour control. However, these changes should always be made in consultation with a medical professional, as timing adjustments must account for kidney function, medication interactions, and patient-specific factors. It is also important to address lifestyle contributors, such as poor sleep quality, high sodium intake in the evening, or undiagnosed sleep apnea, which may exacerbate early morning blood pressure elevation. A comprehensive approach combining accurate measurement, medication optimization, and lifestyle modification yields the most effective results. In conclusion, ignoring morning blood pressure spikes can lead to missed opportunities for prevention and control. Regular monitoring in the early hours, alongside professional guidance, enables more precise management and helps reduce the risk of major cardiovascular events. For older adults, this proactive strategy plays a critical role in maintaining stable blood pressure and protecting long-term heart health. Managing blood pressure in older age is not just about taking medication. It requires a daily awareness of the small habits that influence cardiovascular health. As we've seen, many of the most damaging behaviors are subtle, often unnoticed, and easily overlooked. Skipping medication, using the wrong cuff, consuming hidden sodium, becoming dehydrated, staying seated too long, overusing NSAIDs, or ignoring morning spikes. Each of these can gradually raise risk without immediate symptoms. The good news is that every one of these habits can be corrected with informed action. Reviewing your routine with a healthcare provider, making small but consistent adjustments, and staying engaged in your health can significantly improve blood pressure stability and reduce the risk of serious complications like stroke or heart failure. If you found this video helpful, consider subscribing to Radiant Health 60 for more science-based guidance tailored to older adults. Please like and share this video to support others managing high blood pressure. And in the comments, let us know. Which of these 7 habits surprised you the most? Your heart health is in your hands. One choice, one habit, and one day at a time.